Thank you, Mr. Yoho. Thank you for holding this special order on a topic that could not be more relevant than at this very time. Failures of Obamacare. As a healthcare professional myself, the elected representative of over 700,000 constituents, and the grandfather of 13, I have a duty to see that access to medical care is more affordable for the welfare of my patients, for my constituents, and for the livelihood of my children and my grandchildren. Obamacare moved us away from the patient-centered, affordable medical care, the traditional doctor-patient relationship that we've enjoyed for well over a century. It was designed by Washington bureaucrats, Obamacare was, who, unlike other Americans, are exempt from Obamacare. In the last 24 hours, I've heard from nearly 1,000 of my constituents who are overwhelmingly begging me to repeal Obamacare and replace it with a bill that restores their health care freedom. That's no surprise to me. I've heard from thousands of my constituents, including my own patients and my own family members, about how their premiums have skyrocketed, their deductibles have skyrocketed. They have health insurance, but they can't afford to access medical care because their deductibles are too high, and their longtime family doctors are no longer accepted as providers in their new health insurance. They have to drive long distances to get to a new and different doctor in their medical plan. They've had medical care interrupted. Simply put, they want this Obamacare nightmare to end. A truck driver from Hardin County told me how she was forced to switch plans last year from the PPO that she wanted to keep to an HMO that she did not want. This has made it significantly more difficult for her to find a doctor who accepts her insurance when she gets sick out on the road, even though she pays much higher in premiums than she did last year for her PPO. Melissa, who lives in Harris County, has the same story. Last January, she had to switch her family to an HMO plan because of Obamacare's limited choices in her community. This forced her family to leave their doctor of 20 years and their local pharmacy. Melissa said, "I have always been a very responsible American citizen, and yet Obamacare told me what kind of plan that I had to buy." This is what Obamacare does. It makes decisions for patients instead of the other way around, brute federal force. The message is clear. Obamacare's top-down, big government approach is leading to higher premiums, less choice, and insufficient access for people in my district and all across this great land of ours. These higher out-of-pocket costs and premiums have priced too many Americans out of the insurance market altogether. Melinda, who lives in the county next to me, had an Obamacare plan last year and paid nearly $600 a month, and she also had a $3,000 deductible. She has to spend over $10,000 before her health insurance plan pays for anything. And even with these high premiums, her insurance plan would not cover many of her asthma medicines or the cataract surgery that she desperately needs. This year, when her premiums went up another $100, she dropped coverage altogether. And under Obamacare, now she's lost affordable coverage, and now she must pay a penalty, a tax. Angela from Harris County actually decided to sign up for an Obamacare plan after going uninsured for some time. Unfortunately, she soon realized that the cost vastly outweighed the benefits. So this year, she chose again to go without insurance. Now she pays the Obamacare tax. Others in my district don't want insurance coverage or only want catastrophic coverage, yet they are forced to pay expensive fines. Their freedom of choice is grossly limited. Gina, a hard-working single mother and a business owner, told me that she is now forced to use the little bit of money that she gets from her tax refund to pay the Obamacare tax. Charlie from Harris County says that he wants me to vote to repeal the individual mandate, stating that Obamacare has forced him to buy a product that he doesn't want. Obamacare relies on force and on coercion, But this is not the American way. And if Obamacare is so good as our Democratic colleagues maintain, then why did a larger percentage of Americans elect to pay the penalty than to take the subsidy for their coverage last year? The American people deserve much better. I've got hundreds of similar stories, including those from a college student who couldn't work more than 27 hours a week over her Christmas break to earn money for school because the Obamacare law imposed costly mandates for her employer if she does. Obamacare is in a death spiral and is imposing too much pain and suffering on the American people. Premiums have gone up on average by 25% across the country for enrollees this year alone. Some states like Arizona, 116% increase in premiums. 25% of Americans have only one health insurer to choose from. And 50% of Americans live in areas with only two insurance providers. Folks, that's not a choice. The complaints I'm hearing now are at a fever pitch, and the American people are demanding change now. We need a patient-centered health care system driven not by mandates and coercion, but by freedom and by choice. For my patients, for my constituents, for my family, and for all Americans. Thank you, and I yield back.